Good afternoon, everyone, and welcome to the Baldrige Foundation's Institute for Performance Excellence webinar, Building Relationships for a Strong Workforce. Before we get started today, I want to take a moment and recognize members of the Mac Baldrige Society who serve as trustees of the Foundation's Institute for Performance Excellence. It is their generous support that make presentations like today's possible. And here's today's agenda. Our guest presenters are Guilford Prickett, Learning and Development Clinical Advisor for Southcentral Foundation, and Barbara Sappa, Director of Human Resources at Southcentral Foundation. Following their presentations, we will have a few questions from the audience and some closing remarks. So now I'm going to turn it over to Barbara to get us started.
Hi, thank you, Al. Thank you for joining our presentation, Building Relationships for a Strong Workforce. My name is Barbara Sappa. I'm the Director of Human Resources. I've been at Southcentral Foundation for 18 years. I started answering the phone at the front desk in Human Resources and have continued my educational and development workforce journey with SCF for the last 18 years. I am Alaska Native. My family is Eyak, so we're from Cordova area in Alaska, and I have two children that are also patients, customer owners, we call them, at Southcentral Foundation, so I receive all my services here, and thank you for having us. Gil?
Hello, everyone. My name is Gil Prickett. I am a Learning and Development Clinical Advisor at Southcentral Foundation, working in our Development Center. I have been with Southcentral Foundation for almost 20 years. It will be 20 years in September. Started my career at SCF as a behavioral health consultant, a master's level clinician working in our outpatient primary care clinic. Worked in that role, pardon me, and as a clinical supervisor for other behavioral health consultants for the majority of my career here, and have been in this role as supporting the learning and development and training needs of the organization for several years. I am originally from Georgia, so I'm a transplant to Alaska, but this is home now. I've lived here for 25 years, and it's hard to imagine being anywhere else, both in terms of being in Alaska and being at Southcentral Foundation. I'm going to turn it over to Barb to get us moving these first few slides.
So just a reminder to use the chat feature for any questions that you have. So we'll be happy to answer those at the end for the Q&A session. To kick us off, we like to share our mission and vision. So our mission is working together in the Native community, or a Native community that enjoys physical, mental, emotional, and spiritual wellness. And then our mission being working together with the Native community to achieve wellness and health-related services. There was a lot of thought that went into our mission and vision in developing that to build a strong workforce and build relationships. And you'll notice that many of our, if you walk around our campus, you'll notice that many of our staff, if you ask them what the mission and vision was or is, they'll say something community, wellness, spiritual, mental, working together, and they tend to blend them, and that's okay, right? But the idea is that we wanted something very simple and something that will rattle off of your tongue, right? So sometimes there's mission or vision statements that are 4 or 5 sentences, which may work for that organization. But for us, we wanted something that employees, stakeholders, customer owners, the board can easily say, just like I did. I started saying the mission when I said vision, but it resonates. And so I think that's an important thing when you want to ingrain the mission and vision into your workforce, is to make it easy, make it relatable, and make it simple. Sorry, it's taken a little time to, I think, move to the next slide. But the next one is our goals. So if you think mission and vision is very large, we like to break down our mission and vision into something a little bit more relatable, which is going to be our goals. Sorry. think it's trying to catch up. There we go. Thank you, whoever did that. And to a little bit more relatable, right? So you got to break down the mission and vision into something that we can integrate into our workforce. So we have an acronym. We love acronyms at Southcentral Foundation. It's shared responsibility. So there's the S of Southcentral Foundation, commitment to quality and family wellness. And then, of course, we have operational excellence. So that really doesn't fit into any of the three for SCF, but it is important to us. And we want to ensure that we're able to continue these services for our customer owners, my children, forever, right? And so we do want to ensure that that's ingrained into the work that we do and is expected of our employees and our customer owners. The next one we have is customer ownership. So I had an employee that did a great analogy, right? And so I'm gonna try to live up to her standards and share it because I think it's important. And that when you go to a department store, say you go to Nordstrom's, which they closed our Nordstrom's down in Alaska, very sad day for us Alaskans. If you go to Nordstrom's and you're buying a pair of jeans, right? And you have a wonderful salesperson, they were known for their sales here up in Alaska, and they say, you know, what cut do you want? What size do you want? How do you want it? How do you want it to fit? How tight? How loose? You know, and then they keep bringing you pairs of jeans to keep trying on. Okay. That's really the idea of what we want for customer ownership, which is you own the system, right? You have a voice in what you're saying. You have a voice in your healthcare. And so you're really a customer. Our patients are considered customers. We're asking them what they want for their healthcare. What are their goals and how can we help them achieve those goals versus being told, right? Alaska Native people have a long history of being told what to do and how to do things versus having the voice integrated into how a system is developed. And that's the idea of customer ownership and being the customer. For owners is that we are Alaska Native people and we have built the system. This is our system. This is our funds that we use to help support the system. And so the idea that somebody's a customer, but also the owner is very important to us in creating long, healthy families. And then here's operational principles. Many years ago, Southcentral Foundation and services for our customer owners, all employees in the workforce worked really, really hard, but the system was not designed in order to be successful. It just wasn't. The operations of the system was not created in order to be successful. So everyone worked really hard to provide the best services they can and weren't really able to achieve the goals of being a health community or the mission and vision. So we surveyed our stakeholders to say, what do you want in a system 50 years from now? And there was a laundry list of things, right? And so how do you, looking forward, design a system to meet the needs of our customer owners? And that was the foundation of what we consider the operational principles. And what I like to say is they're the bumpers, like if you play bumper cars or drive down the road and there's the railings. The operational principles in my mind are you can do all the great improvements in the world, but you have to stay within these bumpers, right? This is what Alaska Native people are saying that we want. And you have to stay in that because if you go out of that, you're really designing something that is not in line with what is being asked. And so when we have improvements, we compare them to the operational principles to ensure that we're not going outside of those boundaries. And I will pass it over to Gil to talk about core concepts.
All right. Thank you, Barb. So core concepts, and we'll talk about core concepts again shortly, because this isn't just an idea about how to do things, but it's also something that we've built into the way that we create relationship and build connection across the organization between employees, between clinical staff and customer owners across the board. And it's grounded in this idea of wellness. And again, that ties back to our mission and vision, right? Where we talk about wellness. That has to be foundational to everything that we do, right? So wellness, whether it's about how we're working together, how we're building relationships with one another, how we're engaging with others with compassion, how we share our stories, which is an important part of South Central Foundation. But these core concepts that are linked directly to wellness are a pretty integral part of the way that we approach everything we do at South Central Foundation. That goes from when someone's showing up for a visit, maybe in primary care or pediatrics clinic, to when we're interfacing with the community through health fairs and job fairs, right? This concept of wellness and linking that to everything else we do is a pretty important part of how we show up. So let's share just a little bit of information with you about South Central Foundation, if you are not familiar with us. So South Central Foundation was originally incorporated in 1982, so 42 years ago. At that time, and in 1987, just a few years later, there were 24 staff for the whole organization. As of this year, we employ a staff of 2,700 across multiple clinical and non-clinical roles. In 2005, which is shortly after I started working here, we had 51 active programs. At this time, we now have 95 active programs with more in development to better meet the needs of our customer owners. We currently serve 70,000 Alaska Native and American Indian people living in what's called the Anchorage Service Unit, which if you were to look at the Anchorage Service Unit on a map, it's the size of a small country. It's an enormous swath of the state that runs up into the interior, out the Aleutians for part of the part of the way. It's a large part of the state that we're providing the primary care and specialty care to the Alaska Native and American Indian communities and individuals living there. In 2000, we were providing services to just under 15,000 people. So you can see how in the last 25 years, there's been some pretty significant growth in the number of people that we provide care to. Some of that's the population is growing. We're a young population, so we have a lot of younger people who have growing families. Some of it's also due to the fact that there's been a lot of in-migration from rural Alaska, people relocating to Anchorage and the Anchorage Service Unit and creating, new lives here. So a lot of growth. I don't anticipate that's going to change anytime soon. I think that we'll probably be close to 80,000 sooner than we realize. If you look to the left side of the screen, you can see that in 1987, we had an operating budget of $3 million. For fiscal year 24, our operating budget is $554 million. So a pretty substantial increase in the operating budget. But you see the kind of growth that we're talking about in terms of staff, programs, and customer owners served. The Baldrige journey, I can't remember if this is you or me, Barb. It's me. Okay, sorry.
I did the same.
Our Baldrige journey started in 2005 when we first submitted our application to the national program. We went through that process a couple of times, and we're actually in 2011 were awarded our first Baldrige Award with our fourth application. We make applying for or writing the application actually part of what we do every year, whether we're applying or not, because it helps us keep the goals in mind of the things that we want to see in terms of improvement of service and improvement of care for our customer owners. We applied again in 2017. That was our fifth application, and we won our second Baldrige Award. We've continued to submit applications after that. However, we did take a pause from submitting applications between the years of 2020 to 23, when as a healthcare organization, it was really our responsibility to prioritize COVID response and recovery. And although we're on the other side of that, that's still something that very much is a part of what informs the way we take care of our customer owners. Our 6th Baldrige application has been submitted this year, and we are excited to experience this process again.
Okay. Thanks, Gil, for forwarding that slide. The next thing I'm going to talk about really job descriptions, but that's the smaller piece of it. What I do want to start with is what we call workforce competencies. This really became out of how do you get the workforce moving in the same direction at the same time. And I think it was an early part of the Baldrige journey for SCF to answer, right? Is how do we get everyone moving in the same direction? How does everyone know what they're supposed to be doing? How does everyone know what their small role is of 2,700 people to achieve the mission and vision of the organization? And so we had to look at our how we looked at workforce competencies, how we looked at evaluations, how we looked at how those competencies were integrated throughout the workforce system. So the first thing we did when answering that question about moving people in the same direction was to interview our stakeholders, customer owners, employees, board of directors, the community, about what SCF needs or what does the workforce need in order to move the same direction. And we came up with a laundry list of items, right? Tons. And we were able to reduce it to some major themes at SCF. And we came to 4, right? And I'm going to go back to my statements in the beginning, which was around mission and vision. You want it to be simple and easy to remember. And so we wanted the number of workforce competencies to be simple and easy to remember for employees. So those workforce competencies for us are workforce development skills and abilities, customer care and relationship, communication and teamwork, and improvement and innovation. And those 4 workforce competencies are integrated into the work that we do. So it begins with job descriptions and moves through the performance management cycle, what we call performance development plans. So that's created at the beginning of the year to let employees know, what are you supposed to accomplish this year? And that's your piece to mission and vision, because it's all formulated around the 4 workforce competencies. The second piece is really the evaluation at the end of the year based on the performance development plan. And again, everyone's merit increase, their evaluation is based around those 4 workforce competencies. We do pay for performance model, so their merit increase is directly tied to how well they perform around those 4 workforce competencies. It's also integrated in many other functions across SCF when it comes to the workforce. So when we can, we very much align them to these 4 workforce competencies. One thing I like to point out when I say customer care and relationships and communication and teamwork is that 50% of our workforce competencies are focused around relationships, building relationships with customer owners, as well as peers, colleagues, coworkers, anyone that you work with. So how you work with people is directly tied to your merit increase. 50% of your merit increase is directly tied to how well you work with people. The other thing I like to talk about for workforce competencies is that they are not, they're all worth the same amount, right? So when it comes to the merit increase, they're all worth 25%. There's 4 of them. One isn't because you're in a finance role, improvement and innovation isn't worth 10%. It's worth 25, just like everybody else. So the value doesn't change per workforce competency, and I think that's important. And I think the other important thing to note is that 25% workforce development skills and abilities workforce competency is the technical skills, right? They're important, but they're not the most important thing at SCF. We truly believe that building relationships is the most important thing, and therefore is the top 2 when listed, and the technical skills are at the bottom. Same importance, 25%. So they're not less on the merit increase, but intentionally the fourth one. So we start at the job descriptions, and this was really a heavy lifting when we first developed workforce competencies, is we wanted to start with the foundation of what employees are expected to do when they do their job. And a lot of times people look at that don't work at SCF, look at our job descriptions and say, what is the job? What am I doing? And that kind of is a flag for us, right? And the job is working with people. And this is how we expect you to work with people, because they see customer care and relationships and how we expect them to work with customers, or communication and teamwork. It's not the technical skills, right? And we want to reinforce that. So the job description really outlines the position of responsibilities based in those 4 workforce competencies. And that's what employees agree to, they sign off on. You know, the accreditation companies come in and they look at that and they see it, and you sign off on your job description, and that's what every employee sees. And again, they're categorized into those 4 workforce competencies. And it really provides the foundation. It's the first thing employees see when they come in. It's what they apply to when they're candidates for a job. And it's how we see through performance management, including corrective actions, performance improvement plans, and yet again, reinforcing the 4 workforce competencies, which is our piece in achieving the mission and vision of the organization. So we want to also link the right behaviors to the SCF goals. So shared responsibility, commitment to quality, and family wellness, as well as operational excellence. And creating that link to our strategic planning cycle is important for us. And the performance management cycle is connected to the performance of the organization and the strategic plan overall. Through our strategic planning tool. We also have what we call the performance management toolbox. There's lots of options and opportunities for employees to be successful at Southcentral Foundation. And the joke is that it's really hard to get into SCF, and it's really hard to get fired from SCF. And it's true, because we like to work with people, right? And oftentimes, by the time managers are done with an employee, they come to HR very frustrated. And part of that is finding out where the employee is at in their life journey and trying to meet them where they are at while working at Southcentral Foundation. Now, that doesn't mean that we don't terminate employees, right? We just work with them. And so when they're going through the toughest times of their life, if we truly are a healthcare system, we truly try to support them no matter what they're going through. And we have lots of ways to do that. And it's beyond corrective action. So we don't have progressive discipline, 3 strikes you're out or anything like that. There are things that can be, are termable quicker than others, of course. But we want to work with people. Part of what Gil talked about with core concepts is that you want to work with people and work with their stories, right? Part of core concepts is sharing your personal story and receiving story. And how do you receive a story in a healthy way? And so HR spends a lot of time coaching managers and employees on how to share story and receive story in a healthy way in order to accomplish a strong and successful workforce. We also want to ensure that we're recruiting for the right fit at Southcentral. So as you can imagine, we are in the center of the state of Alaska, meaning that people tend to come into Anchorage to live. It is the largest city in the state of Alaska. But we don't have a medical school in the state, and we don't have a lot of resources, and we have to spend a lot of time recruiting outside of Alaska in order to bring professionals into the state to work for us. But we want to ensure, no matter what, we have a right fit for Southcentral Foundation. So you can love SCF and you can love what we do, but we want to make sure that it is a good fit, because how we do practice is a little bit different than what other individuals may be used to. And so we want to interview around those 4 workforce competencies. So we do behavioral-based interviewing, so asking about past behavior to predict future performance. Around those 4 workforce competencies, right? So we're asking a lot about how you worked with customers, how you worked with coworkers and peers, improvement projects you've worked on, and the technical piece of how you do your job, because that's important too. We also want a cultural right fit. So like Gil said, we have a large service area at SCF, and we want to ensure that there is a cultural fit into the organization, but also the community. So if you're working and living and moving into a small community, we want to ensure that there's community members that participate in the interview to ensure that there's a cultural fit. We're also going to do community-based recruitment. So instead of going outside, the state of Alaska, we also recruit internally. And we want to ensure that we look for Alaska Native American Indian people nationally, but also locally to recruit. And then when we move to remote locations for recruitment and to have people live there, we do have the community partake in that interview process. And it's important that the folks integrate into that community and do it well. And so part of that is the recruitment process and making sure it's a good fit for SCF, but also the candidate. And then also how you onboard. So Gil will talk about onboarding in a little bit. Our selection process, we do team-based interviewing, so almost no interview at SCF is done solo. So we invite the potential supervisor, we invite people that would report to this individual, be peers with the individual. Very much a group team-based decision and hiring practice. We do like to prep our candidates to ensure that they're aware that there's going to be more than one person, because it can be overwhelming. So we try to ease that in. So that's often a question like, how do you do that? And it's not easy, but we want to make it a relaxing environment as possible. And so our managers work to ensure that that happens. And again, it's behavioral-based interviewing. So we're trying to elicit a story around those 4 workforce competencies. And it's not about how many questions you ask. We often ask more follow-up questions than primary questions on the interview. And then again, we always want to make sure that we have a right fit for the organization as well as for the candidate, right? So if we're thinking about moving somebody from out of state, that's great. We want to make sure it's a right fit for the whole family and not just that one candidate that we're hiring. So when we bring them up to visit, we want to bring the family up as well, because they have to be prepared. You have to be prepared. I still have snow in my front yard. You have to be prepared for end of May and there's still snow or the darkness that comes. So we want to make sure that they stay to ensure long longitudinal relationships over time when you think about healthcare. So if they're fulfilling their 2-year service obligation and then leaving SCF, that's not what we want. We want them to stay. We want them to make a life here. We have, I know Baldrige loves data. We love our data. So this is 2023 fiscal year information. Our benchmark is 87% for our retention. We're still working on increasing our retention post-COVID. I'm sure many of you are as well. We're currently at about 82%. And so we're continuing with work groups to focus on increasing that retention to pre-COVID numbers. And because the population we serve is Alaska Native American Indian people, we want to have our eye on the percentage of workforce that is Alaska Native American Indian. And we're at about 53%. So that's exciting. And again, all these numbers are a little bit lower than post-COVID, but are pre-COVID. And we're continuing to increase those, but that's exciting. Gil will talk a little bit about some training programs, but one thing we recognized is that a lot of our entry-level positions were Alaska Native American Indian people. And then when you got to the manager level, they were mostly non-native. So over the past 7 years, we've really focused on increasing our Alaska Native American Indian managers. And this number just continues to go up, and Gil will talk about that in just a minute. Pass it over to you, Gil.
All right, thank you. So how do we do this? We really work to do this in three main ways. There's early investment, partnership and support of employees, and relationship-based learning. So for looking at onboarding, early investment is really key. So we have a fairly robust new hire orientation. So for instance, in 2022, we had about 652 people attend new hire orientation. That takes place over a week. I know in many organizations, NHO is 1 or 2 days, right? We feel that it's really important to invest that time up front to help people understand not only just what are the regulatory things we all need to know, right? But what is this organization about? And so we have people who are coming and talking about the cultural aspect of working in a tribal health organization. We have people coming and talking about the different aspects of our workforce competencies. That's part of new hire orientation. And we also recognize that there's a need for really robust department onboarding. And so we partner with departments in order to help them build out really robust onboarding in the department. I would say that it's not unusual for it to be a month after someone starts before they're actually doing the work that they were hired to do full time because of the onboarding process. We really want people to feel prepared and ready for that and feel like they have the tools and the knowledge that they need, not just clinical or technical skills, but the cultural skills in terms of the culture of Southcentral Foundation. We also have multiple entry-level onboarding programs. As Barb said, we are constantly working to increase, especially in clinical roles, but across the organization, the number of Alaska Native American Indian people in those roles. And we have a variety of ways in which we do that. One of the main tools we talk about, and I think we speak about it a little bit more in depth later, is something called ASTP, the Administrative Support Training Program. All of our entry-level admin support, front desk staff, etc., they come through that training as a paid 8-week training program that they go through to learn basic administrative skills and learn more about the people side of work. How do you work in collaboration with other people? How do you work in relationship with other people? How do you develop effective communication skills? That's been a significant investment on the part of the organization for a very long time, and continues to be one of the main ways that new people come into the organization. The goal isn't let's have people come in and stay in administrative roles. It's let's have people come in, they start in an administrative role, and then they have all sorts of other opportunities to grow and develop professionally in the organization. We also have some entry-level clinical programs, such as our CMA Certified Medical Assistant Scholarship Program, where we're prioritizing the growth and development of Alaska Native and American Indian medical assistants, with the goal of using that potentially as an inroad for folks who are interested in a clinical career. We also have a dental assistant training program where we prioritize Alaska Native and American Indian people into those clinical roles in dental, with the goal of potentially, again, allowing that to be an inroad to developing a clinical career within the organization. We also currently have a clinical initiatives scholarship program where we are funding the education for scholarship recipients in a variety of clinical fields, in behavioral health, in nursing. We are looking at, again, increasing the number of Alaska Native American Indian people in some of those higher level clinical roles. And the scholarship has been very successful, and we're having a lot of interest in it for folks. These are not folks that have to be in Alaska. These are Alaska Native American Indian people from across the country, with the expectation, of course, that there's going to be a service obligation, and we want them to come work for us. We also partner in support of employees. So how do we do that? Well, we work with subject matter experts across the organization, whether that's in finance or facilities or behavioral health, to design content and facilitate trainings. Well, that's starting with new hire orientation, but we have hundreds of trainings that we offer throughout the year, where we partner with the subject matter experts in the fields wherever they happen to be. And we also look at how can we build career ladders. So we have progression checklists that are connected to our job descriptions that Barb referenced earlier, that show how do we help someone progress from, say, a 1 to a 2, like a program coordinator, and make it super clear what the goals are and how to support them. All of this is grounded in this foundation of relationship-based learning. People don't learn in silos, people learn in relationships, right? So our core concepts tools that we utilize, and we've talked about some, we'll talk about a little bit more. The use of story, being vulnerable when you're in conversation with someone, whether you're a leader or an employee, and acknowledging the wisdom in the room. When you get a group of people together, regardless of what the titles are, there's a lot of information and knowledge in that room. And we want to acknowledge that and use that to benefit everyone. That's how we walk together and support one another to learn and grow. So, talked a little bit about this already. I jumped the gun, but I'll revisit this a little bit. We want to grow our own. As Barb mentioned, we don't have a medical school here in Alaska. We sometimes struggle to get people engaged with the growth and development of clinical careers. And so we're investing money into helping do that. So our clinical initiatives program, again, we have behavioral health positions that we're funding, people going to school to become therapists or counselors or social workers, even nurse practitioners or physicians, right? But we have scholarship dollars to help support that. People getting their nursing degrees, just like everywhere else, there's been a bit of a struggle in the last several years to find and hire nurses. And so we're growing our own. We're paying people to go to school to become nurses to come work for us. Our certified medical assistant program, where we're using that as kind of that clinical entry level position, along with the dental assistant training program to get people into the field and meet a pretty significant need. And then something that's unique to us is we have a tribal doctor training program. For several years, probably 20 plus years at this point, SCF has had what we call a traditional healing clinic, where we have tribal doctors who practice traditional indigenous ways of healing with our customer owners. And it's a referral-based system where a primary care provider could refer someone to the tribal doctor, to the traditional healing clinic. And we've developed a fairly robust tribal doctor apprenticeship and training program, again, to grow our own, to have people who feel drawn to that kind of work, get trained by some of the elders who are our tribal doctor leaders, but also other clinical folks. So they have a solid foundation in kind of bridging traditional practices with Western medical practices. And it's a really cool program. When we look at things on the non-clinical side of things, we have some resources in place that are helping us grow our own. The first one is an entire system called the Leadership Development and Succession Planning System. Say that fast 10 times. LDSPS. And it's really built on creating a sustainability and succession so that as we continue to grow, as we continue to bring in new people and have people who are ready to retire and move out, that we have a pipeline of new leaders to step in and take on new leadership responsibilities. And that's a really important thing in a company that's growing as quickly as we are, and that we anticipate being around for a very long time. We also have what's called our MSIT, Manager and Supervisor in Training program, where we identify people who are not currently supervisors or people who are not currently managers, but want to grow into those positions. They go through an interview process, they get hired into a role as a manager in training or supervisor in training, and they go through a robust several month long program where they are given lots of skills and tools to support them in the role of a manager or supervisor. We've just hired recently our third cohort for that, and I'm pretty sure they've all been claimed by various departments or divisions that say we need that person in this role. So it's a way of helping us grow and develop managers and supervisors and set them up for success before even being in the role. And then I mentioned previously our ASTP program, Administrative Support Training Program. I can't tell you how many people who work across the organization in lots of different roles, clinical roles, leadership roles, but across the organization, who their entry into the organization was an administrative support training program. We'll talk a little bit more about that as we go. This even starts before people are coming into the workforce officially, right? We have something called the RAISE program. And the goal of the RAISE program is to help Alaska Native youth grow and begin the next steps in their education and professional training. This is an internship program that we offer every summer. Alaska Native youth between the ages of 14 and 19 are eligible to apply. They then participate in an internship over the course of the summer. It's a paid internship, so they're working, and they learn a variety of different, like, clerical tasks. They're learning administrative tasks. They're learning what it means to be a professional, right? And it's a way of help them to start identify, what is it I want to do? What career would I like? We have a lot of SCF employees, including SCF employees who are in leadership positions, who started their career as a RAISE intern, right? We have a new class of RAISE interns who will be coming in here. School just ended here in Anchorage, so we have a new class that will be starting here in the next couple of weeks. It's always a lot of fun to see them when they come in, because you've got all the energy and vitality that comes with a group of kids, and they bring that in, and it really makes it it's really a lot of fun to see. But I can think just in the department I work in, where we have about 50 employees, I can think of 4 or 5 just off the top of my head who I know started as RAISE interns and are now part of the workforce and have some significant responsibility. One of those people was somebody who was a RAISE intern, went through ASTP, and now runs the ASTP training program. So it's really cool to see that kind of growth and continuity. And so this stuff doesn't happen for free, right? There has to be an investment. There's an investment in time, and there's an investment in dollars. So if we look at 2023, the benchmark from the Association for Talent Development and the benchmark from Saratoga for learning and development dollars spent per employee is around $1,200 to maybe $2,500. SCF spends more than that at almost $2,900 per employee. If you look at the number of hours spent in training per year for an employee. We're looking at somewhere between 33 and 47 hours a year. SCF, on average, per employee has about 100 hours that are invested in training and learning and development per employee. And I know Barb had some additional information she wanted to share about this.
Yeah, I was just going to talk a little bit about, I think it was core concepts, but I do want to just reemphasize that this really, I know I spoke a lot about the technical skills of the job, but this really goes to speak about how much investment, even though we say it's the fourth workforce competency, how much investment we really are into all of the competencies and also the technical piece, because a lot of the courses that Gil spoke about or he didn't speak about is about the technical courses that are available to our clinical staff here on site, taught by subject matter experts who are also doing the same job or similar job to them. So that's a really exciting model that we transitioned from a very heavy consultancy model to subject matter expert. And so that's been a lot of work of the Development Center here at SCF over the last few years.
All right. So, and I realized what I did. We had two slides that looked similar. Sorry, Barb. So workforce engagement, when we're talking about workforce engagement, what we're really talking about is how do we help support the workforce once they're hired? Because we've talked about how all of the resources that are put into supporting workforce, onboarding and new hire orientation and recruiting. But once they're here, how do we continue to engage with them? We have several different ways in which we do that. And I'm going to start with the Employee Wellness Committee and work my way around to core concepts there. The Employee Wellness Committee is a intra-departmental division work committee that looks at how do we support employee wellness. And this was something that has been a committee for quite some time, but it really kind of came into its own during COVID, when employee wellness, in terms of supporting people who are working really stressful jobs. When you were working in healthcare during COVID, that was intense for a lot of people. People had all of the things that were going on to manage their families and their lives outside of work, right? So we wanted to give people as many tools as possible in order to engage in wellness and feel supported. So lots of time and energy has gone into and continues to go into this committee, with the end results being things like providing culturally appropriate wellness activities for people to do at their desks, in their homes, whenever they have time, when they need some time to kind of check in. Providing resources that they can use at any time, such as access to a corporate Calm account. So Calm, which is a meditation and a relaxation app. All SCF employees, through the work of the Employee Wellness Committee, have access to a Calm app, which has been hugely beneficial to a lot of people. We talked a little bit about the leadership development and succession planning. That's a part of workforce engagement. It's a way of helping people stay engaged and look for opportunities for growth. We continue to do that and are working on ways to do that. And that really is something that has taken a long time to build, and we're still growing it. But it's looking at how do we help develop our next generation of leaders. We have an employee engagement committee that looks at all of the things that connect to how employees feel connected to the organization. So, for instance, if we think of, we talk a lot about the voice of the customer. That's a voice of the customer for employees, in a way, to feel like they have some voice in the growth and development of the resources available to support individuals who do the important work that we do here at SCF. Probably the main tool that we have for workforce engagement, though, is core concepts. Core concepts is, so we had a slide at the beginning of the slide deck that talked about core concepts, and we linked that to wellness. But core concepts is more than that. Core concepts is actually a 3-day corporate-wide training that we have all employees go through, usually within 6 months of hire. That really looks at the importance of relationship and the importance of building and sharing, building relationships and sharing story with our colleagues, with the teams we work with our customer owners. We've been doing core concepts for, 15 plus years at this point. It's a really important part of the way that we do things here. And I've heard people refer to it as the secret sauce that makes SCF, because it provides all employees, regardless of what role they're in, regardless of what their degrees or credential are, regards all of them to show up as themselves, as an individual with a story, and to create a safe space to share that story and to receive and respond to the stories of others. So as of right now, we have about 91% of the workforce at SCF who have completed core concepts. That's in large part due because we did a massive push in 2023 to get employees through. As with many things, COVID made doing some of the things that we would typically do regularly more challenging, more difficult. And one of those things was core concepts, right? Typically, this is something to be offered quarterly, generally speaking. And there were a couple of years there where it was really difficult to do that because we didn't want to get a large group of people in a room together. Just wasn't a good idea, right? So last year we did core concepts about monthly, I think maybe even a little more than monthly, and we had 695 employees attend. We also had, I'm not sure the exact number, but we have guests from other organizations around the world who will come to attend core concepts as well. And so we probably, that number of people who actually attended core concepts last year is probably a bit higher if we include those guests. But just in terms of employees, almost 700 employees who attended core concepts last year to help us reach that threshold where we are, where we have these shared skills and tools to work from. And I think, Barb, you wanted to speak to this a little bit as well.
I just want to be cognizant of time. I know that there are like 6 minutes left, and we do have a few questions in the box. I was just going to reiterate, Gil, this is the secret to everyone. This is the secret sauce. If you ever get a chance to come to Alaska and come participate in a core concepts, I highly recommend it. It just really is. You can tell the difference before and after core concepts at our conference in the summer. And as an HR professional, it really is how we reinforce relationships at SCF, is being in relationship, and what does that relationship look like? So we do have a few more slides, but I'm just gonna hurry past them. I want to give opportunity. We do have coaching sessions. We created our own coaching session. It's a week long. Managers and employees and leaders at SCF participate in coaching. And it's practice, right? There's a lesson and then half day of practice. And then the fifth day is a full day of how to coach while being coached. And this is, we have lots of PDSAs every year focused around our strategic plan for workforce development and building relationships with our workforce. And then we have lots of great stories of success at SCF. They put me here on here, so that's me then and now. Sonda Tetpon's our Vice President of Dental. Here's her today. Crystal Mosseri, she's our manager of our corporate office. She's been here like 25 years, some insane amount. And Denise is our manager of corporate events, and her here today. So we like long tenured employees at SCF. And then so we'll go ahead and turn it over for questions.
Fantastic. Well, Gil and Barbara, thank you for that presentation. It was simply outstanding. We might have to do a part 2. I mean, I'd love to bring you back again. We've got a bunch of questions here, and just as a reminder, everybody, if we don't get to your question, and we're only going to have time for a 1 or 2 here, the panelists will answer them via email and get back with you at some point here in the near future. But the first question that I wanted to send your way is, what are some of the strengths that Alaska Native values bring to South Central Foundation's workforce?
Oh man, I would say family. As a HR person, I tend not to say, I don't want to insult people by saying we're your family, because I think people get insulted by that. But and some people don't, and I want to be cognizant of that. I don't want to hurt anybody's feelings. But on our employee engagement survey, it's not me saying it. On our employee engagement survey, it really is about family and culture and community. And over again, that's our biggest strength across the employee engagement survey. And I think that is one of the biggest things that come into our workforce. The other thing is celebrating our culture and diversity. Even though we're focused on Alaska Native American and Indian people, we really focus on celebrating everybody. Our board of directors and our VPs really got on board to something like Juneteenth, right? Like, we want to make that our holiday, and it is a holiday. And a lot of thought goes into when you make something a holiday, because that's a whole day out of work. And so it's important to us to celebrate cultures across the world, as well as our own, and how we integrate that, because we're not just Alaska Native American Indian people celebrating here.
Okay, here's one that caught my attention here from the audience, and that is it's a little bit technical. How do the job descriptions tie work functions to the 4 core competencies? Are there headers for each, or is it implied that the role aligns to the competencies?
Yes, so in the job descriptions, performance development plans, evaluations, it's about the header. All the content underneath is co-created by the employee and the manager. And you can have 2 people in the same position, and we use templates, but it's expected that you customize it to the person as well. So again, in that co-creation piece. So it's the header, the content is the co-created piece.
Okay, well, we only have about a minute left here, so I want to thank you both again for your outstanding presentation and addressing those few questions there. And so we're going to go to the next slide. And just a reminder to everybody that the Foundation's Institute for Performance Excellence has more than 400 training and professional development certification opportunities offered online and at your own pace. This month, we are showcasing 3 certification courses relating to today's presentation: Nonprofit Skills for Leaders, a certificate in nonprofit management, and nonprofit management total. If you want to visit the Baldrige Foundation Institute at baldrigefoundationinstitute.org/education, you can learn more and register. As a reminder, the recorded version of today's webinar and today's presentation slides will be available on the Foundation's website early next week. And once again, thanks to all of our great sponsors and donors. We hope to see you all again at next month's webinar on June 26th for a Baldrige Enterprise update. Watch your email for additional details and registration information. Thanks again for attending this afternoon, and have a great day.